So this drill has been given to you because you have a very stiff hip in through internal rotation, and it's very difficult for you to sit in the 90-90 position on the floor. I'm a perfect example of someone that should be doing it the way that I'm going to show, because sitting in this 90-90 position here, it's very hard for me to just stay up here. It feels like I have to like crunch my spine over. My pelvis is jamming up into my ribs. I'm really not in a good tall sitting position here. And so I need something to bring me up to make this drill a little healthier for my lower back and my hips and my pelvis, so that I'm not creating these horrible compensatory patterns and not getting everything that we need out of these drills that are meant to be hip specific and isolated. So what we'll do is I'm going to use a med ball here to sit on, but we can always stack books, pillows, yoga blocks, bolsters, anything that gets you elevated to take a lot of that pressure off of your spine and really focus on the hip. So I'm going to take a 90-90 position here on the ball. And I'm going to use the wall a little bit here, and I'm going to use things to support me so that I can maintain and hold a tall spine. So I've got this kettlebell, I've got the barbell here, I can hold on to anything else in this position, and I'm going to slowly start to turn my torso towards the right leg that I'm getting this internal rotation 90-90 hip stretch out of. It's just a modified version of it. So once I feel this stretch showing up in like the front pocket here, sometimes slightly underneath, like towards like the adductor, deep in the hip, but without any pinching. We're trying to avoid pinching sensations. We're going to stay in this position for roughly 2 minutes, just to allow this stretch to occur. And it's definitely easy to get fidgety in these positions. So if you need to, you can readjust yourself. You can come in and out of that position and turn your torso towards it deeper, and then come out of it, inhales, exhales. It's pretty free game. We just want to make sure that that hip is still experiencing some sort of stretch sensation. And that stretch is meant to be comfortable. It's not meant to be painful or brutal. It should be something that you could physically sit in for about 2 minutes. Once the 2 minutes has gone by, we're now going to create the PAILS and rails contractions. And so that first contraction that we're going to utilize in this type of position is actually driving the knee down in towards the ground and almost thinking like I'm sliding that towards the midline here to really capture the inner thigh. And I'm going to slowly ramp up a contraction there for 10 seconds. I'm going to keep my core nice and engaged through this whole process. Once the 10 seconds is up, I'm going to slowly start to relax that. And instead, I'm going to, since I have my foot planted up against the wall here, I'm going to start to elevate my knee up towards the ceiling to get a rails contraction. And I'm just going to hold this position for 5 to 10 seconds. And then slowly bring it back down, and then I will turn my torso deeper. Now I'm going to stay over here. Now I'm not going to move, because I'm only going to have to be here for about 30 seconds. And then once that 30 seconds is up, we're going to do that PAILS contraction where the knee is sliding more toward the midline and dropping down into the ground. And I'm going to start to ramp up my core contraction and ramp up an adductor contraction, getting like 50 to 70% effort here. Once the 10 seconds is up, I'm going to relax that. I'm going to elevate that knee up towards the ceiling. I'm feeling a really strong contraction on the outside of my hip. Keeping my core engaged, staying tall in the spine, and relaxing, and then coming out of it. So this is a great option to do if you really struggle to get into that 90-90 position, and just having more regressions to this so that we can progress and maybe eventually get to the ground. So at the end of the day, as long as we're seeing some sort of result, moving in the right direction in regards to range of motion or decreasing discomfort and improving your flexibility, then staying in a regressed position sometimes is just what's meant to be for certain body types.